This includes pediatricians and family doctors' offices, pharmacies, children's hospitals, community health centers, rural health clinics, and school-based clinics. While our program is just fully up and running this week, by the end of the day today, we estimate that over 900,000 kids ages 5 through 11 will have already gotten their first shot. And through pharmacies alone, 700,000 additional appointments are already on the calendar at local pharmacies. Parents and families across the country are breathing giant sighs of relief, and we are just getting started. We will continue to work with governors, local leaders, healthcare providers, and others to build on this progress. Minnesota has stood up more than 1,100 locations for parents to get their kids vaccinated, including at the Mall of America, which is the biggest mall in the country and now home to a site that can vaccinate 1,500 kids a day. Across the country, 114 children's hospitals are now offering vaccinations and engaging their communities, with many hosting family-friendly vaccination events featuring stickers, pets, and stuffed animals. We're helping states meet parents and kids where they are through FEMA-supported mobile clinics from Asheville, North Carolina to Florence, Oregon. And this week alone, New York City has over 1,000 clinics planned at schools, including early morning hour clinics before the work and school day begin. Next, in addition to the new program for kids ages 5 through 11, we remain focused on vaccinating unvaccinated individuals. Looking at the last 7 days alone, we're averaging about 300,000 first shots per day. That's the highest 7-day total in almost a month. The simple truth is that vaccination requirements are working. In fact, vaccination requirements have helped reduce the number of unvaccinated Americans ages 12 and older by almost 40%, from about 100 million in late July to under 60 million now. Vaccination requirements get more people vaccinated, strengthen our economy, and help continue us on our path out of the pandemic. Next, on booster shots, which add an important layer of protection. In total, over 25 million Americans have now rolled up their sleeve to get the enhanced protection of a Pfizer, Moderna, or J&J boost. So our boosters program is running strong. Stepping back, across the past week, we've administered over 9 million total shots in arms. 9 million shots in arms. That's the highest one-week total since before the summer 5 months ago. It's clear that our efforts to help parents get their kids vaccinated, to vaccinate the unvaccinated, and to get boosters to eligible Americans are driving significant progress in our battle against the pandemic. Next, on testing. Today, we're taking another step to expand access to rapid diagnostic tests administered at doctors' offices, hospitals, and other healthcare settings. HHS is investing $650 million from the American Rescue Plan to provide manufacturers of point-of-care diagnostic tests advanced purchase commitments so that these manufacturers can scale up their production. Today's action builds on our $3 billion investment to increase the production of at-home tests, 4 new over-the-counter at-home tests authorized by the FDA since the start of October, as well as other actions by the FDA and NIH that will increase testing options and decrease prices for consumers. The bottom line, we've made significant progress on increasing overall testing capacity since late summer, including by quadrupling the available supply of at-home tests to over 200 million per month starting next month. Last, on ensuring our response is equitable and reaches the hardest hit communities and those most at risk, On his first full day in office, the president took historic steps to center our COVID-19 response around equity, and he established the COVID-19 Health Equity Task Force. The president's leadership and our intentional, constant focus on equity has produced significant results. We've effectively closed gaps in adult vaccination rates by race and ethnicity. The most recent Kaiser Family Foundation survey showed that 73% of Black adults, 72% of white adults, and 70% of Hispanic adults had gotten at least their first shot by mid-October. We know we have more work to do, but this is significant progress we can build on. Earlier this morning, I received the final report from the COVID-19 Health Equity Task Force, which will help us do just that. The report includes recommendations on how we can continue mitigating health inequities caused by COVID-19 and further advance equity in our response. I want to thank the whole task force for their thoughtfulness and expertise in the development of this invaluable report. And I especially want to thank Dr. Nunez-Smith for her outstanding leadership. With that, let me turn it over to Dr. Nunez-Smith.
Thank you so much, Jeff. And good morning to everyone. Really a pleasure to be with you. As Jeff just noted, equity has been at the center of President Biden's COVID-19 response from day one. And through our work these past 10 months, we've shown in COVID-19 health equity, it's not just aspirational, it is achievable. Today, I did have the privilege to submit the Presidential COVID-19 Health Equity Task Force final report to Jeff. And the report is a manifestation of a vision that started with President Biden and with Vice President Harris. By way of origin, during the Vice President's last year in the Senate, she introduced a bill that became the blueprint for this task force. She knew then that the voices of public health experts, practitioners, and community leaders together could be a powerful driver for health equity in this pandemic. And the president also saw the critical importance of this focus on equity. Just as Jeff mentioned, that very first full day in office, he issued that executive order. It called for a whole of government effort to reduce inequities in COVID-19 prevention, treatment, and across our response as a whole. And it is that vision, it is that leadership at the top that makes it possible for us to say today that this task force has done something that is truly powerful. The administration fully recognized that the most affected groups are often the first to be forgotten, especially when resources are in short supply. COVID-19 made it clear that in this country, a person's zip code is a stronger driver of their health than their genetic code. And so we set out to find ways to acknowledge, to address, and overcome those social, those structural drivers, and forge a path forward rooted in what is fundamentally fair. And so the work of the task force, this group systematically advanced 317 recommendations. 55 of those are prioritized and highlighted in the body of the final report, along with 5 proposed priority actions that will help accelerate that vision for change. Investing in community-led solutions to address health equity. Enforcing a data ecosystem that promotes equity-driven decision-making. Increasing accountability for health equity outcomes. Investing in a representative healthcare workforce and increasing equitable access to quality healthcare for everyone. And recognizing just the need for continued coordination and implementation and leadership of the task force recommendations. The 5th priority action area is that work continue from an equity infrastructure within the White House. This is a historic slate of recommendations. And it's remarkable that they were developed really within just 8 months since our first meeting. I'm also extraordinarily pleased to report that the administration has already begun action aligned with an estimated 80% of the prioritized recommendation. And much of that action has been achieved through the White House COVID-19 response and agencies across the federal government, underscoring that whole of government commitment to equity. And as Jeff noted, the gaps that once existed in vaccination rates among Black, white, and Latinx adults has closed. The latest CDC National Immunization Survey that was completed at the end of October that mirrors the data we've seen from the Kaiser Family Foundation, from the Pew Research Center, also from Gallup. These data collectively tell the story of what is possible when you begin and commit to equity at the center. This progress, it was made possible because we called on all of society to join us, and they did. This is the reflection of the work of partners and communities across the country, ensuring access, confronting misinformation, prioritizing vaccination uptake. Every step of the way, meeting people where they are, leveraging existing resources, utilizing the resources we provided, from tax credits to grants to the vaccine itself. And so to push us further, I'm pleased to announce today that the U.S. Department of Health and Human Services will invest $785 million in American Rescue Plan funding. Those funds will support community-based organizations that are continuing to build vaccine confidence across communities of color, rural areas, and low-income populations. Those funds will support tribal communities leading the way in mitigating the spread of the virus. We'll also protect individuals with disabilities from infection and the ramifications of the pandemic. And will allow us to continue our mission to build a more diverse and sustainable public health workforce, including by establishing a new innovative apprenticeship program to train thousands of our COVID-19 community health workers and prepare them for high-skilled, long-term careers in public health. Today's funding announcements are directly responsive to the task force's recommendations. And they also build on the historic investments we've already awarded for equity-focused programs and initiatives over the past 10 months. Advancing equity requires full participation by each one of us. And I too want to extend my deep appreciation to the remarkable task force members. That includes the 12 members appointed by the president for the contributions they made to their communities, as well as the 8 federal ex officio members designated to represent their agencies across the federal government. And it takes an entire team to support a presidential task force. And so thank you to the federal staff team who worked tirelessly to elevate our vision, and to the CDC Foundation for its support. And lastly, I want to extend my heartfelt appreciation to the more than 100 subject matter experts who joined us, the countless number of stakeholders who provided public comment, attended listening sessions, and briefed us. We could not have walked this journey without you. Achieving health equity, it is mission critical for the Biden-Harris administration, and not simply because it's the right thing to do. There is absolutely no way forward. There's no credible path to a new normal without it. Our nation has begun the hard work to recalibrate. We must stay the course. We must accelerate the health equity journey. So as I close, I want to personally thank President Biden and Vice President Harris for the opportunity to lead this historic task force. It has been an honor. It has been a privilege to serve in that role. And with that, I'll turn it over to you, Dr. Walensky.
Thank you, Dr. Nunez-Smith, and good morning, everyone. I want to start with the data and provide you a closer look at the current state of the pandemic. The current 7-day daily average of cases is hovering at about 73,300 cases per day. The 7-day average of hospital admissions is about 5,000 per day, also relatively stable from the previous week. And 7-day average daily deaths are about 1,000 per day, which is a decrease of about 11% from the previous week. Last week, following ACIP's unanimous vote, I endorsed their strong recommendation that children 5 to 11 years old should be vaccinated with the Pfizer pediatric COVID-19 vaccine. This committee is comprised of medical and public health experts from across the country, including pediatricians, professors, researchers, and chief medical officers. As experts in their respective fields, they have collectively provided scientific guidance and trusted counsel throughout this pandemic. The committee members are also parents and grandparents who, after their vote, powerfully shared their personal excitement to vaccinate their own children and grandchildren, offering protection to those they love most. The voting members of the committee and I agree that the available safety, immunogenicity, and efficacy data support getting our children vaccinated. This recommendation was further recognized and supported by the American Academy of Pediatrics and the American Medical Association. Over the past week, I've been so encouraged by the stories and precious photos I have received personally and seen in the media of children getting vaccinated. I'm hearing from parents who are breathing a sigh of relief that their younger children, ages 5 and up, are now able to be protected against COVID-19. And I am seeing the joy in children who are excited to get vaccinated as a critical next step in getting their life back to normal. Still, I hear questions from some parents. Is the vaccine safe? What are the risks of COVID-19? Should I vaccinate my own child? Today, I want to answer some of those questions for you. On this slide, we have a list of several vaccine-preventable illnesses in children. CDC currently recommends vaccinating children against hepatitis A, meningococcus, and varicella, the virus that causes chickenpox. These decisions were made because of the risk of these infections to our children. In fact, as you can see here, in the years prior to the recommendation for hepatitis A, meningococcus, and varicella vaccination, the average annual reported deaths from these infections were 3, 8, and 16, respectively. All of those numbers are far lower than 66, the number of deaths we have seen from COVID-19 in children 5 to 11 over the past year. What is clear is that COVID-19 poses a significant risk to our children, with more than 2 million cases reported in children 5 to 11 since the start of the pandemic, and 66 deaths over the past year, as well as the risk of additional complications like MIS-C and long COVID. While children remain more resilient than adults to this virus, they still remain at risk, and with the help of vaccines, we can prevent COVID-19 and many other diseases that were once fatal. COVID-19 vaccines for children have the potential to protect more than just our children's physical health. We have seen the ways this pandemic has threatened the social and emotional well-being of our children. For many children, school has been a safe and enriching environment. For this past year and a half, many children have felt the effects of school closures, outbreaks among students and school staff, and ultimately changes in their normal school environment due to COVID-19. At the beginning of the school year, I made it clear that it was our goal to return to in-person learning. With our prevention strategies in place and with vaccines now available, together, we can help protect our children and keep them in school for in-person learning. Pediatric vaccination holds the promise of protection for our children, their families, and our communities. And to the 60 million Americans ages 12 and older who are not yet vaccinated, and to the 28 million children 5 to 11 who are now eligible, I strongly encourage you to roll up your sleeves and get vaccinated today. Thank you. I'll now turn things over to Dr. Fauci.
Thank you very much, Dr. Walensky. What I'd like to do for the next couple of minutes, in the context of a recent announcement from the Pfizer company about an antiviral drug, is to put this into some perspective and just briefly outline for you where we are in our advances in our strategy in the development of antiviral therapy for COVID-19. Next slide. The underlying strategy is to identify vulnerable targets in what we call the replication cycle of the virus, and then to either screen, but importantly, to design drugs to inhibit those vulnerable targets. Next slide. This is a slide that looks somewhat complicated, but it really simply tells us the big circle is the cell in the body, such as the cell in your upper airway, nasopharynx, and lung. And at each point, you see the smaller circle is the virus. There are processes within the replication cycle that are vulnerable to inhibitors, such as those highlighted in yellow: protease inhibitor, polymerase inhibitor, entry inhibitor. Let's take a look at one of these. Next slide. And that is the polymerase inhibitors. As we all know, just a little while ago, next slide, the Merck company, together with Ridgeback, showed clinical data that they announced of a very impressive placebo-controlled trial of around 1,500 people in which the DSMB stopped the study after 775 people because the endpoint of preventing hospitalization or death was met, in which there was a 50% decrease in hospitalizations or death in the treatment versus the placebo arm, with 8 deaths in the placebo and no deaths in the treatment arm. Of note, the federal government, particularly the NIH and the Defense Threat Reduction Agency, did the basic research funding in academic institutions like the University of North Carolina and Vanderbilt and the University of Alabama at Birmingham to do the research that led to the companies doing an extraordinary job in developing these antiviral therapeutics. Next slide. And now, most recently, we hear of the development of a protease inhibitor. Next slide. And that is the Paxlovid, or the protease inhibitor from Pfizer company. And again, as you know, just a few days ago, the results of a placebo-controlled trial of around 3,000 people was done, and a very, very impressive 89% reduction in hospitalizations or death was seen in the treatment arm compared to the placebo arm, with 10 deaths in the placebo arm and no deaths in the treatment arm. This is an orally administered antiviral similar to the molnupiravir, which when given within 3 to 5 days of the initiation and recognition of symptoms has this important clinical effect. Again, next slide. The US government did play a role in the development. For example, early consultations with Pfizer referring to researchers providing screening methodology, in vitro testing, and the NIH-led Accelerating COVID-19 Therapeutic Intervention, or ACTIVE team, generated the clinical trial protocol. So all of this is good news in that we now have one with already has an EUA and one putting in for an EUA to have an orally administered antiviral therapy. I want to close with the last slide next, which is an important message. Although antivirals are promising, we must be sure to get our population vaccinated. Antivirals, as good as they are not our first line of defense against COVID-19, because we all know it's much, much more important to prevent an infection than it is to treat. Obviously, if a person gets infected, it is critical to get them good treated. You saw the data that showed 50% to 89% diminution in the risk of hospitalization. The way you get a 100% decrease in the risk of hospitalization is to not get infected in the first place. And finally, get your booster shot when it is your turn. Back to you, Jeff.
Well, thank you, Dr. Fauci. Let's open it up for a few questions. Kevin?
Thanks. And we only have time for a few questions today. First question, let's go to Erica Edwards at NBC.
Hi, yeah, thank you so much. I wanted to go back to the number of kids ages 5 to 11 who've been vaccinated. Where did those numbers come from? What was the source? And is the CDC confirming those numbers?
Good. Well, thank you for that question. As you know, we've talked about several times, the program for kids 5 to 11 is a new program with new sites and specialized doses being shipped out to those sites. Many of the places that adults go to get vaccinated are not the right places for kids 5 to 11. So we're bringing on the 20,000 sites that we've talked about, including children's hospitals, pediatricians, family doctors. So many of these are new locations, and therefore it takes time for them to come online to begin to give doses to kids and also to begin to report. So to estimate how many 5 to 11-year-olds have received a first shot, we collected data directly from vaccine partners, including the pharmacies and state and local and health officials. We ran an analysis of those numbers including numbers that states are beginning to share publicly. So some states do have on their websites the public information. And based on the analysis and based on the gathering of all these data points, we estimate conservatively that at least 900,000 children aged 5 to 11 have received at least their first dose. Our goal clearly is to vaccinate as many kids as possible. This is the very beginning of the program. The program is just getting up to full strength, as we've talked about this week. So we expect more and more kids to get vaccinated across time, and 900,000 shots in arms by the end of the day is a good start. Next question, please.
Let's go to Zeke Miller, AP.
Thanks for doing this. Also on kid vaccinations, I was hoping you can speak to the expected pace. What is the capacity right now for how many shots you can inject into the arms of those 5 to 11-year-olds? And, do you expect that 900,000 in a week pace to accelerate? Or, is that what we should be expecting from here through, to that population of 28 million is vaccinated?
So, Zeke, I would not think of 900,000 as the pace for a week because it's really just the last couple of days where the doses have arrived and the 20,000 sites have stood up. So I think it's a pace that is much more than 900,000 on a weekly basis. Daily, as we talk to states and their teams and talk to the pharmacies, more and more sites are opening, like the Mall of America site that I mentioned that has the capacity to vaccinate 1,500 kids a day, the mobile clinics that are being deployed across the country. So the pace will be increasing across the next several days and across the next couple of weeks. So I think we have, as we've talked about, plenty of supply for all 28 million kids between the ages of 5 and 11. We have 20,000 sites that are now stood up with more coming online. So we expect the pace to continue to accelerate across the coming days and weeks. Next question, please.
Diane Haslett, ABC News.
Hey guys, thanks for taking my question. States like Colorado have gone ahead and urged everyone over 18 to get boosters as cases spike. But we have repeatedly heard from this team that we're not going to boost our way out of the pandemic. So I wonder, will this approach work? Do you encourage other states to do this ahead of the winter?
Dr. Walensky.
Yeah, thank you so much for that question, Diane. First and foremost, we want to get everybody who's eligible to be vaccinated, who has not yet been vaccinated, to get vaccinated. That I think is the most important in terms of preventing hospitalizations and death and infection in and of itself. For those who are eligible for a boost now, we would absolutely encourage that they get boosted, those over the age of 65, certainly those with comorbid conditions, and then people who work and live in high-risk settings. And then I would say to really get our adolescents vaccinated and our younger population, our newly eligible 5 to 11-year-olds. And I think that will very much help us in preventing some of these surges that you're hearing about. And as you likely know, FDA is currently looking at the data for expanding boosters to all populations.
Just to add a few numbers, as I mentioned earlier, more than 25 million Americans have rolled up their sleeve and gotten a booster. And that's clearly a very strong start to the program. For the Pfizer eligible 65 and older, because as you know, Pfizer was authorized by the FDA and CDC earlier, several weeks ago. Close to half of those who are eligible 65 years and older have gotten their booster, so that's real progress. This month, so far, we're averaging close to 800,000 booster shots in arms per day. That's up about 50% from October. So lots of progress. And as Dr. Walensky said, we encourage everyone who's eligible to get their booster soon. Next question, please.
Tom Howell, Washington Examiner.
Hey, how you doing? Tom Howell, Washington Times. You talked about how hard it is to put a number on the vaccinations needed to reach what we call herd immunity and how that number will be determined if and when it happens. So I want to know if you can clarify the scientific goal behind the workplace mandates that increase uptake of the vaccines. Is the goal to keep more workers healthy and on the job, keep hospitals clear and running, that kind of thing? Or is the goal to decrease transmission in and around the workplace, given the shots do provide some level of protection against infection, but that protection took a bit of a hit from the Delta wave? Thanks.
Well, I think it's all of the above, and I'll turn to Dr. Fauci and Walensky for anything they'd like to add. The COVID has had a real impact on the workplace. There's been a significant increase in absenteeism, sick days, people getting infected at work. There are many people who are not in the labor force because of COVID, childcare needs or health concerns. So it's really important that people feel like they have a safe and healthy work environment, and people being vaccinated or along the lines of the OSHA rule, being tested a minimum of once a week is really important for workplace safety, for our economy, and for us beating this pandemic. Dr. Fauci, Dr. Walensky, anything to add there?
Yes, as Jeff said, it truly is all of the above. Obviously, we want to keep people out of the hospitals and prevent them from going on to the severe outcome of death. But you're also going to diminish infections in individuals. Obviously, no vaccine is 100% protective against infection, but you do go a long way. But as we've all said, the biggest disruption of the workplace is when people get COVID. And that's the reason why we want to do everything we can to keep the workplace flow at its normal level by preventing disease. And it's for that reason why it's so important to get the workers as well as everybody else vaccinated. But the bottom line is it is all of the above that we're trying to do.
Last question.
Last question. Let's go to Cheryl Stolberg at New York Times.
Thanks for doing this call. I have a couple of questions. First, the president set out a goal of having 70% of adults get at least one shot before July 4th. So I'm wondering, do you have a specific goal for kids and a time frame by which you would like to get a certain percentage of the 28 million vaccinated? And also, when will the CDC have actual numbers to report? That's one question. And then separately, we haven't heard that much about variants, and I'm just wondering what variants are on the horizon or what concerns you going into the winter.
Why don't we start, Dr. Fauci, with the variant question, then we'll come back to the kids.
Well, Cheryl, right now, the Delta variant still overwhelmingly dominates the isolates in our country with greater than 99% of them. We always keep our eye out for any variant that's out there to determine whether or not it is overtaking in prevalence or not. And when we do get a new variant, we always do studies to see whether or not they evade or not monoclonal antibodies or convalescent plasma or the antibodies that are induced by vaccines. But right now, our problem is the Delta variant, without a doubt, as well as the fact that we are very alert in looking out for the emergence of other variants.
On kids, I want to emphasize again that we have plenty of supply for all 28 million kids, ages 5 to 11. Now we are with 20,000 sites, trusted sites that parents and kids are used to going to and feel comfortable. There's lots of locations, and appointments can be scheduled at many of these locations. Also, locations are open for walk-up in many locations. So I think we are set up to continue to vaccinate more and more kids ages 5 to 11. We're off to a very strong start with 900,000 kids already having received their first shot, 700,000 appointments already scheduled at local pharmacies alone. We just want to make sure that we answer any questions, continue to answer questions that parents or kids might have about the vaccines and get as many kids vaccinated as soon as possible at these convenient locations. Dr. Walensky, on the data question.
Yeah, I don't have much to add there. As you noted, with new places coming online, there is a bit of a data delay in terms of getting those data to us, and we're working actively with the states to have those come in, and with our pharmacy partners and with our pediatric and children's hospital partners.
I want to thank everybody for today's briefing and look forward to the next one. Thank you.
Secretary of Veterans Affairs, and Senator Elizabeth Dole. Ladies and gentlemen, the First Lady of the United States, accompanied by some of our country's hidden helpers. Ladies and gentlemen, please welcome Steve Schwab, CEO of the Elizabeth Dole Foundation, and General Mike Liddington, CEO of Wounded Warrior Project.
Good morning, everyone, and welcome to a very special celebration of America's Hidden Helpers, the millions of children across America dedicating their young lives to assisting in the care of our wounded, ill, and injured service members and their veterans. My name is Steve Schwab, and I'm the CEO of the Elizabeth Dole Foundation, and it is an extraordinary honor to be invited to stand on this stage and recognize the service of these incredible young Americans. And I'm very glad you took your seats. Tomorrow on Veterans Day, we salute the American heroes who served our country with duty and honor. Today, we recognize the hidden heroes and their hidden helpers whose service begins when their veteran returns home. The Dole Foundation was proud, so proud, Dr. Biden, to stand with you this year as you rolled out Joining Forces 2.0, a movement with a mission to bring all sectors of society together with our government partners to support our veterans and our military families. Today, we stand with you once again, joining forces with this administration to introduce America to our hidden helpers and announce a series of incredible commitments to make a substantial impact in their lives. This is what joining forces is all about. So, Dr. Biden, we thank you for your leadership and for your invitation to join you at the White House today. Secretary Austin, Secretary McDonough, thank you for holding caregivers and their families among your highest priorities. We are honored and proud to be working with you and your teams in rolling out new levels of support for our nation's military families today. Last year, we commissioned research experts at Mathematica to conduct the first ever study of military caregiver kids. We knew it was time for us to better understand the implications of the long caregiving journey on children inside those families. And the findings, which we're also releasing today, should not only concern our nation, they should inspire us to act and act immediately. Thanks to our research, we now know that approximately 2.3 million children under the age of 18 live with a disabled veteran. The study tells us that these children in these homes experience high levels of disruption, resulting in elevated levels of distress. This can cause severe emotional impact and impact their psychological development. This is further strained by the fact that a caregiver's attention to their children's needs is often crowded out by the overwhelming needs of their veteran. These kids also have difficulty expressing their complicated emotions and at times have trouble learning in school. The study also found that young people helping as caregivers suffer from social isolation and health problems related to stress, burnout, and fatigue. I've been fortunate enough to meet some of these hidden helpers personally, as you will today, and I can tell you that these negative outcomes are not the only similarities they share with their moms and dads. They exhibit extraordinary love and compassion. They are patient and understanding. Their experiences mold them in ways such as giving them empathy for those with different physical abilities, kindness for those who need it most, and a willingness, this is most important, a willingness to help others. Anticipating that the research would be as concerning as it is, we partnered with Wounded Warrior Project to build a strong and diverse coalition. Could I ask our coalition members to raise their hands? Let's hear it for our coalition members. So many friends in the room. That coalition is going to address the gaps in services and support for our hidden helpers on day one, and that day one is today. I'm so proud to co-chair this coalition with Mike Linnington, CEO of Wounded Warrior Project. We're now 60 organizations strong due to our great work with Mike and his team, and we're ready to deliver support to the millions of military and veteran families across America. It is now my pleasure to introduce an exceptional leader and a steadfast advocate for our wounded warriors and their families, my friend, Mike Linnington.
Thank you, Steve. It's great to see everyone. Let me begin by saying how proud I am to serve as co-chair of the Hidden Helpers Coalition as we lead our nation in responding to this important study that Steve just spoke about. One that should indeed be a warning and a call to action for all of us who depend on the service, sacrifice, strength, and resilience of our military men and women in uniform and their families. Among the distinguished leaders I'm honored to share the stage with, Dr. Biden, Secretary Austin, Secretary McDonough, I must also recognize and thank the incomparable Senator Elizabeth Dole. Senator Dole is the epitome of a servant leader and a role model for all of us. 10 years ago, Senator Dole made a pledge to military and veteran caregivers at Walter Reed, where she was caring for her husband, that she would tell the nation their stories of service and sacrifice and ensure our caregivers did not endure their caregiving journey alone. Today is an extension of the movement Senator Dole has led for the last decade. Thank you, Senator. Ladies and gentlemen, the study we bring to you today asks a critically important question. How have the wounds of our warriors and the caregiving responsibilities of their families affected the youngest of our military and veteran family members, our children, who reside in the home and help care for a wounded warrior? Our nation's military has answered the call to serve for nearly 2.5 centuries, yet we've never asked that question, dove deeply into it, despite it being one of the greatest worries keeping so many of our military caregivers awake at night. Children of our nation's military and veteran families are valued assets to their parents, their brothers and sisters, and the communities in which they live. Whether children or siblings, these hidden helpers have a meaningful role in helping care for their wounded veteran family member. And it is incumbent on us now that we do whatever we can do to support them and care for them as well. The research from this report will not only provide us with the reasons we must act, but it will also serve as our guide to actions in the future. According to the research, we must focus our efforts in 4 main areas. First, developing interventions that focus on peer support, mental health, and age-appropriate developmental opportunities. Second, funding, promoting, and creating mechanisms of support for the entire family members, the entire family unit, the entire military and veteran families. Third, reduce any lingering barriers that our military and veteran families still encounter while trying to access care, especially in their communities. And finally, amplifying awareness and understanding of the sacrifices made by our wounded warriors and the toll taken on the family caregivers. I am grateful, as Steve said, to the more than 60 organizations and leaders who have already joined our coalition to address these priorities. Together, we will create a network of support for these young helpers as they continue to navigate the responsibilities and effects of the last 20 years at war. But there is so much more work for us to do. That's why today I am announcing that Wounded Warrior Project is increasing our commitment to support the research and initiatives of this coalition through a new $1.5 million dedicated fund. Through this investment, we will partner with coalition members to ensure that a network of support, resources, care, programs, and services for the youngest caregivers of America's wounded warriors is available and, as importantly, easily accessible. Thank you again, Senator Dole and Steve, for leading this important charge. It now gives me great pleasure to introduce the 11th Secretary of Veterans Affairs, the Honorable Dennis McDonough. Secretary McDonough is no stranger to this building, having previously served our nation as the White House Chief of Staff under President Obama, where he worked across the cabinet to carry out the president's priorities and strengthen the operations of the federal government. Prior to that role, Secretary McDonough served as Deputy National Security Advisor for Strategic Communications and chaired the National Security Council's Deputies Committee. Throughout his service in the White House, Secretary McDonough helped lead the administration's work on behalf of military families and veterans. And I'm pleased to say he continues to do that great work today as our nation's current Secretary of the Department of Veterans Affairs. Mr. Secretary, thanks for being here, and thanks for caring as you do for our nation's veterans and their families.
Thank you, Steve and Mike, for your leadership, not only at the Elizabeth Dole Foundation at the Wounded Warrior Project, but also in leading this remarkable Hidden Helpers Coalition. And to our audience here in person and those virtually, leaders from the government, the private sector, our military and veteran nonprofit community, thank you for being here. On behalf of President Biden, the amazing Dr. Jill Biden, and the entire Biden-Harris administration, a team deeply committed, as the military family in this building is committed, to ensuring that military families have what they need to thrive. Welcome, everyone. November is National Family Caregivers Month, a month to reach out to those who provide care for their family members, friends, and neighbors in need, to honor and to thank them. November is also National Veterans and Military Families Month, when we show our appreciation to spouses, partners, children, caregivers, and survivors of our service members and veterans for their selfless sacrifice on behalf of the nation. And tomorrow, of course, is Veterans Day, a day when America pauses to remember and recognize those men and women who fought our nation's wars and defended us in periods of restless peace. This is the time to recommit ourselves to those we're privileged, honored to serve, to renew our obligations to veterans and their families, survivors, and caregivers who make their own sacrifices, serving quietly, too often without fanfare or celebration. President Biden reminds us our one truly sacred obligation is to prepare and equip troops when we send them into harm's way, and to care for them and their families when they return home. And we know that when a veteran needs help, it's the whole family that is helping. Even the youngest, beautiful children. So it's only appropriate that we celebrate those children. A story about a caregiver and a veteran and his caregiver bears repeating. He's a quadruple amputee. Needs his wife's help for most everything, from brushing his teeth to getting dressed to putting on his prosthetics. People say to him all the time, "Thank you for your service." And he appreciates it deeply. But nobody ever thanks his wife, his caregiver, for the service she's given to this country by taking care of him. That's wrong. It gets to the very heart of why we're here and why Dr. Biden demands we do what we do. To honor and thank caregivers and their children for their service to this country. Because support of caregivers improves outcomes not only for the caregivers, but also for veterans. That's why at VA, we're building a family coordinator program where veterans and caregivers get help for their whole family. Better connect to resources at VA and in their communities. Let's meet one of those great caregivers. Miss Sylvia Lopez Pavon, hailing from, you may know this place, Dover, in the great state of Delaware. Sylvia is the proud caregiver of her husband, Alex, a rightly proud veteran who served around the world for 15 years in the Army and the Army Reserves. Alex, welcome and happy Veterans Day to you. Sylvia recalls two moments marking the beginning of her caregiver journey. The first was when she discovered there's a name for the roles she was playing. When she learned she's a caregiver, she just said in the room, "This is the blue room. This is the best job for me," she said. "It's a hard job, but it's the best job for me." The second came very shortly after, when she learned that, as a caregiver, she's not alone. That there's a remarkable network of caregivers that's in this room to support her and that she can support. Understanding she's a caregiver and knowing she's not alone, she said, was a great feeling. One that's informed her service as a caregiver ever since. Today, Sylvia serves other caregivers and teaches them what she's learned. And she talks about her own experience as a caregiver, which she sees not as something she must do, but as an act of love. Let's welcome that remarkable caregiver, Miss Sylvia Lopez. You're awesome.
Thank you, Mr. Secretary. To you, Dr. Biden, and Secretary Austin, thank you for supporting up for our military caregiver kids. My husband, Alex Pavon, was a mortuary affairs specialist at the Army. The chemicals he used to tend to the remains of the fellow service left him with chronic skin conditions. The many times he was sent to recover the fallings, surrounded by the worst scenes of war, left him with traumatic brain injury, vertigo, and a terrible PTSD. Alex's wounds are so severe that he could not be able to live without me as his caregiver. And the emotions and responsibilities of being his caregiver are so hard that I am certain I could not survive them without the help of our 5 children. Each of our kids help in their own way. Our oldest, Annie and Alexis, take their dad to doctor's appointments. Our 16-year-old Paula keep the youngest one occupied when their dad is struggling emotionally. My 12-year-old Siani, who is here with me today, is our family leader nurse. And a 7-year-old Saribet knows the secret of soothing her dad's moods. Our children are wonderful, and they help me so much but no child is prepared to handle these responsibilities. All my children have attended therapy to cope with their emotions. They have struggled socially because I cannot leave my husband's side and he cannot go to birthday parties, malls, or crowded movie theaters. And some of Alex's flashbacks are so violent that every kid has a place in the house to hide. As a mother, I often feel guilty and helpless. I see the struggle of our children, but I cannot get them the attention they need because I also have a husband whose lives depend on my care. That is why I am so grateful for all of the leaders with us today and the more than 60 members of the Heating Helper Coalition, particularly Esposas Militares Hispanas, which has committed to translated the coalition material. That is such a relief to all of us who have struggled to navigate caregiving in our second language. Most of all, I have to thank Senator Elizabeth Dole. Senator, you first came to the rescue of your fellow caregiver 10 years ago. Now you are coming to the rescue to our children. That means the world to every caregiver parent out here. You are a hero to all of us. Everyone, please join me in welcoming Senator Elizabeth Dole.
Thank you so much. Thank you. Thank you, Sylvia, for sharing your story and for those very kind words. Please give your children a big hug from all of us. Ladies and gentlemen and military kids, I'm delighted to be with all of you today. Thank you, Dr. Biden, for hosting this event and for partnering with the Elizabeth Dole Foundation and our incredible coalition to pursue a new national mission, a mission to provide comprehensive support for millions of military caregiver kids, our nation's hidden helpers. Dr. Biden, I know you have personally felt the emotional weight carried by our military families, and as a national leader, you have united our country around those who serve through joining forces. I was so grateful to see you revive this extraordinary program as First Lady, and I know that our military community appreciates it too. Thank you so much. Yes. Secretary Austin, Secretary McDonough, thank you for helping us ensure that the days of overlooking the caregivers of those who serve are forever behind us. In 2014, I stood here with Dr. Biden and then First Lady Michelle Obama to come together around the crisis facing our military caregivers. We came with a message to awaken the nation. If America did not start supporting our military caregivers, we risk losing the most valuable person in the life of every wounded warrior. We risk losing them to fatigue, illness, to frustrations with red tape and bureaucracy, to debt, to burnout, to overwhelming stress. With a firm belief that America would respond to the call, our foundation set out to systematically change the way our nation supports military caregivers, and we have done just that. Through the largest expansion of military caregiver benefits in history, countless new support programs and direct services, through a growing network of 175 hidden heroes cities and counties, an emergency respite care fund, and a critical financial support program, and through a nationwide training program to teach VA professionals how to incorporate caregivers into veterans' healthcare teams from day one. There is much more work to do. Yet in the 10 years since our founding, we've transformed the military caregiver experience in America. And today, we are committing ourselves to making that same transformative change for their children. Thanks to our foundation's Hidden Helpers Coalition, which we are grateful to be co-chairing with Mike Lennington and the incredible team at Wounded Warrior Project, we came here this afternoon with commitments in hand, ready to make a substantial difference in the lives of America's 2.3 million military caregiver kids. These commitments start with the healthcare leaders from Tri-West, Magellan Federal, Humana Military, and Nemours Children's Health. Together, they will serve as the catalysts for creating a new national model of support for caregiver kids within medical institutions. For the first time, providers will have the tools they need to support and care for our hidden helpers. Thank you, David McIntyre from Tri-West and Larry Moss from Nemours for leading the way. Yes. My thanks also to Mike Lennington and our friends at Wounded Warrior Project for making a generous $1.5 million investment in our coalition's work. Isn't that great? Yes. Cerner has also pledged funding toward programs making healthcare environments more responsive to caregiver kids. David Feinberg, Travis Dalton, and Mike, thank you for making these extraordinary funding commitments. Thanks to the visionary leadership of Sherwin Sheik, CareLinks will extend their support of the respite relief program led by our foundation and the VA. This fund offers free professional care services, much to the relief of overloaded caregivers. We also have an unprecedented number of new programs being launched. I'd like to especially thank the American Red Cross, Camp Corral, Kids Rank, United Through Reading, our military kids, and Psych Armor. And helping us share the news of these incredible programs are our partners at Amazon Military Affairs, Rally Point, and the National Association of Counties. These commitments will make a real difference in the lives of our caregiver kids. We know that because of the research we now have in hand and because of the stories we've heard from caregiver kids. But these commitments are only the beginning. We need the rest of the nation to join us. Dr. Biden, thank you again for your leadership and your partnership. You and President Biden have been wonderful friends to Bob and to me, just as you are to all America's military families. And to every American watching at home, please remember that the hidden helpers we're asking you to support are not grown-ups who chose to serve their nation. They are children, kids, whose young lives have been suddenly interrupted and forever changed. Their innocence is lost as they watch their parent care for the types of wounds that only come from war. Their precious time with mom or dad is cut short. They miss out on their childhood, trading in the milestones and special moments to help with caregiving. Let's come to the rescue of these hidden helpers. Let's relieve them of their mountains of stress and worry. Let's do everything we can to revive their childhood, restore their innocence, and ensure they always have a place to turn to when they need it. This is the next generation of our nation's work supporting those families who have borne the battle. May God bless the millions of hidden helpers across our nation, and may God bless the United States of America. Thank you very much. Thank you. It is now my great pleasure to introduce a distinguished leader who has spent his life loyally serving our nation. During his 41-year career in the United States Army, he rose to the highest ranks, receiving decorations for his exceptional courage, leading our service members in combat. I have been grateful to see him extend the department's full support to our service members, their families, and their caregivers as our 28th Secretary of Defense. Please welcome Secretary Lloyd Austin.
Well, Senator Dole, thank you for those kind words. During my time in the Army, I served a few tours at Fort Bragg, North Carolina, and I got to see the support that you and your husband gave to our military and veteran communities. Let me thank you both for 2 extraordinary lifetimes of service. Let me also offer my huge thanks to Steve Schwab and Mike Lennington for leading the Hidden Helpers Coalition. And it's great to be here with my good friend, Secretary Dennis McDonough. I'm grateful for his partnership as we work together to make sure that we do right by our outstanding veterans. And Dennis and I have worked together on a number of issues, and we're working hard to improve the partnership between our 2 organizations because the Biden administration is squarely focused on supporting our troops, our veterans, and their families. So let me thank the President and Dr. Biden for their outstanding leadership. It's absolutely great to be here with our First Lady. The Bidens are a strong military family, and it shows through your deep commitment to this community. So thank you very much. Do we have any Marine families in the audience today? Show of hands. Okay. Today is the 246th birthday of the Marine Corps, so happy birthday. I have to admit, though, you don't look a day over 245. But this day reminds us of the sacrifices that Marines and sailors and all of our men and women in uniform make to defend this nation. And our military families serve every bit as much as our service members do. We often talk about the hardships, the frequent moves, the sleepless nights, and the stress. But their contributions run even deeper than that. Our military families make us a stronger, a healthier, and a more ready force. So we have to make sure that our phenomenal military families can not only survive the hard times, but they can actually thrive throughout their service. One of my top priorities is making sure that they have world-class health care. And that means treating all wounds, those that we can see and those that we can't. And you've heard me say this before, and I'll say it again. Mental health is health, period. And so we've all got to continue to break down the stigmas that can prevent people from reaching out for help that they need and deserve. And that's especially true for children in the military and veteran caregiving homes. We got to get this right, and we have to do it together. And that includes the Department of Defense and the VA. It includes state and local agencies. And it also includes nonprofit and public-private partnerships like the one that Senator Dole just announced. Now, I want to say a few words to the kids here today. We know that you sometimes worry about your mom and dad. We know how much you miss them when they're not at home. And we know that you take on bigger responsibilities for your family. So the grown-ups in the room today are going to be there to support you, because your love and your strength helps keep our country strong. And because when a parent in uniform thinks about why they need to work so hard to keep our country safe, it's your face that they see. And now I have the pleasure of introducing 2 of these hidden helpers. Gabby Rodriguez is 9 years old, and her sister Ava is 6. Their dad, Jorge Rodriguez, served as a Fleet Marine corpsman. And during a deployment to Iraq, 2 IEDs left him with a hearing loss and a traumatic brain injury and post-traumatic stress. You know, that's a lot to handle. And when he got back home, it was hard for him to remember routine tasks, like when to report to work or when to eat. But Gabby and Ava have stepped up, and they help their mom, Jessica, take care of him. They remind their dad to eat, and they pitch in on countless household tasks. And Gabby rides horses through a therapeutic program that helps veteran caregivers and kids like her, because, as we said before, it can be pretty stressful to have to grow up faster than most. Thanks to these brave hidden helpers, they're coping with the challenges, the frustrations, and the joys of healing as a family. And they're all walking the road together. And the strength and courage of the Rodriguez family are all inspiring to all of us. So, girls, thank you for looking out for your dad and your family. We can't wait to hear from you. So, everyone, please join me in welcoming Gabby and Ava to the stage.
Thank you, Mr. Secretary, and thank you, Dr. Biden, Secretary McDonough, and Senator Dole. My sister Ava and I are so excited to be here and a little nervous, but we knew we needed to be brave and stand on this stage to let every caregiver kid know that they are not alone. So many kids feel lonely because they think they're the only ones who have an injured parent and a caregiver parent. When I was little, our dad spent so much time at Shepherd's Center Hospital because of his brain injury that I got used to talking to other children who had moms and dads in the hospital. When we finally brought my dad home, I would still go to the playground and ask other kids, "Was your dad in the military? Does he have a boo-boo on his brain?" It was 3 long years when I went to a veteran family retreat for military kids that I finally made my first friend who answered yes to both of those questions. And it was a huge moment for me. So I want every other caregiver kid out there to know that there are millions of us. You are not alone. Being a caregiver kid can be tough, but we learn ways to help. My job is to give love and to bring light to my dad's day. I cook pancakes on Sundays, and my sister likes to ask, "How's the weather?" which is code for asking about his mood. When my dad has seizures, I know how to use his phone to call for help, though I don't really like seeing my dad have seizures. I still have nightmares about the first time he had one. I need to sleep close to my parents on those nights. Dr. Biden, it is incredible what you are doing here today. Thank you for showing hidden helpers like me and Ava that we are not alone, and I am very honored to be introducing you. I love that you are both First Lady and an English teacher. Reading with my dad is one of my favorite things to do. We read books for fun and also ones that teach me about his injuries. So thank you for being First Lady and for teaching people how to read and write. Ladies and gentlemen, it is my honor to introduce you to the First Lady of the United States, Dr. Jill Biden.
Thank you, Gabby. My gosh, you did such a beautiful job. Beautiful job. Can we give her another round of applause? And Ava, thank you for standing with your sister today. And you have Whoopi with you, right? Whoopi helped a little bit. You both make your family so proud. And Sylvia, thank you for sharing your story with us. Secretaries Austin and McDonough, thank you for your leadership. I know that you both chose to be here today because you understand that the families serve alongside their members and veterans, and because you are committed to honoring that sacrifice. So thank you. In 2009, with 2 wars raging, I visited Walter Reed Hospital whenever I could. You know, I would sit near the beds of the wounded warriors, usually with a spouse nearby, and listen to their stories of courage and sacrifice. And over time, I built relationships with those families. And my heart went out to the spouses who cared for them. So often, young moms, bouncing babies on their hips. And back then, I marveled at how they seemed to carry their families on will and grit alone, seamlessly moving between feeding an infant and making complex decisions on their husband's treatment. But today, at my very first in-person White House East Room event, I'm thinking about the children in those rooms. I think about how they've grown up, like Gabby and Ava, helping their dad cope with an injury that they can't see. Like Sylvia's daughter, Ziani, who helps her dad, who keeps track of his medications and doctor's appointments. Like Noah, who learned how to get his dad through a severe seizure if his mom wasn't at home. Like Chris, who worried so deeply about his father's well-being that he began to experience a similar trauma. Or like Mason, who became the family entertainer, always ready with a joke or a story to put a smile on his parents' face when things seemed hopeless. These 6 kids in our front row represent more than 2 million hidden helpers across the country who were growing up in the shadow of 20 years of war. Some are old enough to be going to college or pursuing careers, and some are young enough that you still don't understand what makes your family unique. But all of you are serving and sacrificing in your own way. And it's time that we, as a nation, recognize you and commit to giving you the support that you all deserve. Because from a young age, hidden helpers learn the costs of war close up. You see how difficult the road to recovery can be. You know the reality of changing bandages or long stays in hospital rooms. You get tired of having to be brave. And there's no way to, keep you from feeling sad sometimes. So no, we can't shield our caregiver kids from the reality of war or its aftermath, but we can recognize the costs that they last long after our troops come home, and that injuries can be felt throughout generations. We can celebrate caregivers' kids' strength and resilience. We can and we must give our military and veteran caregiving families everything they need to care for their wounded warrior with compassion, dignity, and love. We must bring hidden helper service out of the shadows Let their light shine bright and give them the support that they need to survive. And that's why I am so grateful for the groundbreaking study that the Elizabeth Dole Foundation is releasing today on the experiences and needs of caregiving children across the country. Senator Dole, for 7 years, it's been an honor to stand with you and now to join the Elizabeth Dole Foundation as a member of the Hidden Helpers Coalition. Thanks to your work and the commitment of 60, I want to say that, 60 public and private organizations like the Rosalind Carter Institute for Caregivers, Sesame Street, MSEC, and Psych Armor, we have a powerful coalition ready to step up. And through joining forces, my White House initiative that supports our military and veteran families, caregivers, and survivors, we launched the first ever interagency working group focused on the needs of children in caregiving homes. And the U.S. Department of Veterans Affairs has committed to connecting caregiving families to resources in their communities. Supporting our caregivers is critical to our national security. Our troops and their families need to know that if they ever face injuries, illnesses, or wounds, we will have your back. Gabby and Ava, Ziani, Noah, Chris, and Mason, today is all about you. We're here to celebrate you, your bravery, your kindness, your compassion, and hard work. We're here to thank you for everything you do to help out at home, all the extra chores that you take on, and the times that you watch your brothers and your sisters. We know that you need a break sometimes, and that you need to be around kids and teachers who understand what you're going through without needing to explain it. We're here to honor the sacrifices that you've all made, the time that you've missed with friends, or moments maybe you feel just a little lonely because you feel like your family is different. And most of all, we're here to tell you that you're not hidden anymore. You're not alone. Don't forget that. The president and I see you. The secretaries, Senator Dole, your military, and all of our partners here, we see you. And we see the millions of kids out there who are just like you. But not only do we see you, we stand with you. And we are going to work to live up to the example of courage and duty that you all set every day. Thank you, all of you. And God bless your families. And now I've heard that the Marines aren't the only birthday that we're going to celebrate, because Mason is turning 7 tomorrow. So Mason, can you stand up? Come on, Mason.